everyone for coming. It's a great turnout. It's really exciting to see this level of interest in what we're doing. My impression is that a lot of people here are reasonably familiar with GiveWell, and so instead of going through all the basics, I'd like to give a quick introduction to what we do and where we came from, but then dive into more specific updates on our research that we've done this year and also future research. The way I'd like to organize this is to first talk about the research that we've completed that will go into our new charity recommendations that should come out at the end of the year, and then pause then for some questions. And then after some questions on that, dive into some of the newer, more experimental research we're doing, both related to our GiveWell top charities and also the Open Philanthropy Project, which is open to types of philanthropic opportunities that are different from the ones that we've looked at in the past. The basic story of how GiveWell started is that after coming out of college and working at a hedge fund for a couple of years, Holden Karnowski, who's my co-founder, and I were working at a hedge fund and realized that we were making more money than we needed to just pay our bills. And having experienced that, we decided that we wanted to try and give to charity. And when we started looking for organizations to give to, we found that identifying organizations that we would confidently give our money to was very hard. There was information about charities' overhead ratio, but very little that answered the types of questions we wanted to answer, which was if I give $100 to a deworming organization, or a malaria organization, or a water organization, which is going to help the most people and to the greatest extent. And so finding that those were not questions we were able to answer with available resources, we started GiveWell to be the type of resource that we were looking for when we were in the private sector. Now we've been going for about 7 years, and what we're looking for in top charities are organizations that are what we call evidence-backed, thoroughly vetted, and working to serve the developing world poor. And so our research process focuses on assessing charities to determine whether the programs they're implementing have strong evidence that they're really helping the people that they set out to. There are too many programs that either have no evidence of impact because they've been evaluated and they've been found to not be having the effects they want, or more commonly, we just don't know whether they're making the types of differences that people hope they are. I think that the example I bumped into probably when I was only a couple years older than most of you was looking at water charities. And I would ask them questions, the water charities, do you go back a year later and check whether the wells you've dug are still operating or whether the water in them is clean? These are not the types of questions that most charities have answers to. And so a big part of our research process is evaluating the evidence that the charities programs actually have the impacts that they intend. Another thing we try to look for is charities that have significant bang for their buck. And these numbers are ones that are potentially easily to manipulate. They're very sensitive to assumptions about the way that one models the charity's cost effectiveness. But it still matters a lot to us because if you have one charity that could help 10 people for $1,000 and another that can only help one, assuming you're getting the same impact, we'd have big differences in how we would evaluate those two organizations. We also need organizations that are willing to share a great deal of information with us because information in the charitable sector is very hard to come by. And so without an organization being willing to be transparent and open, it becomes very difficult, if not impossible, for us to evaluate the quality of the giving opportunity. Finally, one of the major things we look for in charities are ones that can effectively use additional funds to scale their activities. And this is something we call room for more funding. It's something that actually will come up a lot in the charity recommendations we're thinking about making this year because the organizations we're considering vary in size from ones that I think could potentially take in $10 million or more to ones where it probably only makes sense for them to receive 1/10 of that. And so then that's another consideration we look at. So what I'd like to do now is just give some brief updates on what the kind of our 2014 research process and where I think we might end up at the end of the year. So first I'll give a couple updates on some of our existing top charities. one of our top-rated charities now is Give Directly, and they do something incredibly simple. They just give out $1,000 to very poor families in Kenya and Uganda. Over the course of this past year, basically everything seems to be going pretty well. They've effectively taken in a great deal of money. They've moved it out the door. They've continued to set the stage for scaling up additionally in the future by soliciting permission from the Kenyan government to go into additional counties. And they've continued to be very transparent and open with us about their program, both things that are going well and things that are going poorly. And so we anticipate Give Directly continuing to be a GiveWell recommendation. The Schistosomiasis Control Initiative, or SCI, is another organization we've recommended for a couple of years. And here the updates on SCI are more mixed. On the good side, there was a new study for deworming that came out over the past year. We wrote about this on our blog recently. And what the study found was that about 10 years ago in Uganda, a randomized controlled trial of deworming was implemented. And later on, another nonprofit went through and administered literacy and numeracy tests to students living in the districts that had the deworming program administered. Upon follow-up of these tests, they found that the students who were dewormed did significantly better on the standardized tests than the students who had not been dewormed, who were in the control group. And so this added a significant piece of evidence to the overall case for deworming as an effective intervention. That's a pretty big, important update, because until now, the evidence for long-term effects from deworming were largely based on a single randomized controlled trial that was conducted in Kenya in 1998. And this randomized controlled trial was conducted under relatively unique circumstances. It was during an El Nino year, which meant that the Lake Victoria, where in Kenya, where many of the residents lived right next to, was flooded. And this flooding led to a large increase in schistosomiasis rates in the year of the program. And so while this study found large effects, we always wondered whether the effects were primarily due to the unique circumstances that were present in Kenya at the time, as opposed to more generalizable outcomes from the condition of deworming. And this study seems to be an update in the direction that the results are more likely applicable to other contexts as well. This study happened to take place in a very nearby area, I think less than 50 miles away from where the Kenya study happened. It may also have been subject to the same El Nino effect, but nonetheless, we're still looking at the data, but nonetheless, this is a pretty substantive update to the evidence base for deworming, and one that's going to lead us to significantly, I think, increase our estimate of the cost effectiveness. So the cost effectiveness we think will improve for deworming based on this additional evidence for the program's impact. On the other side, we still have a lot of questions about SCI's internal monitoring. So this is something we wrote about at the end of last year, but it still weighs on our decision for the coming year. What we had long believed about SCI, going back to when we first looked at them in 2009, was that SCI had implemented deworming programs in many countries in Africa. And then they had studied the people who had been served by their program, measuring infection rates before the program and then in years following. And in the countries they measured, they consistently found large drops in the prevalence of infection. At the end of last year, we wrote a blog post detailing this finding that we had by talking to other researchers, that the studies hadn't worked the way that we had previously expected. Instead of these studies monitoring SCI's program, instead when researchers had gone in and measured the prevalence of the infection, what they immediately did, if they found infection, was treat the child with the pill that cured the infection. The way that the research studies work is they follow up with the same children who were measured in the baseline year. And so instead of these studies being evidence that SCI's programs, these national level mass administrations of drugs, were effectively reducing worm rates, what they instead measured is that when the researcher in the lab took a urine sample to measure the infection rates, he or she was able to treat the child and then find that a year later the infection rates were still low, which is something very different. We asked SCI at the end of last year for additional monitoring reports. They've sent us them. We've been going back and forth with SCI to try and determine whether these have the same problems or not. Some of it has been subject to the same types of communication difficulties that we've written about in the past that we've had with SCI with determining whether or not the research studies had the issues that I'm talking about. And hopefully, by the end of November, when we release our new recommendations, we should have a more substantial update. So with SCI overall, we have, on one hand, this big positive update on the programmatic side, this kind of like problematic issue with monitoring on the organization side, and we're trying to think about how to weigh these two considerations in tandem. It's hard to say how this will eventually play out, but I think my instinct is the research for deworming is now strong enough that it's, I think the investigation of SCI will end up being positive enough that they'll remain recommended, but I'm not 100% sure about that. Some of our research analysts are in London this week at SCI's offices trying to talk through some of the remaining questions we have about their programs. There are also a few new organizations that might go on our list this year, some of which we've written about on our blog and some of which we haven't. So I'm just going to go through them in order. One is called Development Media International, or DMI. They produce soap operas that promote improved health behaviors in developing world communities. They implemented a randomized controlled trial of their program. They basically had 7 radio stations in Burkina Faso air their programming and 7 not, and then measured differences in behaviors between the groups living in the areas served by the program and those that weren't. Thus far, they have midline results for their trial, which include self-reported behavior change. So they've asked people, they might have a message that encourages someone to take their child to the doctor to receive malaria treatment if they have a fever. And when they've followed up with people and asked them how they responded in those situations, people have reported taking the types of positive health behaviors that the DMI message promotes. So this could potentially be a very cost-effective way of improving health behaviors because many people can be reached through mass media. I think the main questions that we have about DMI relate to, first, the fact that the results are self-reported. And it's not entirely clear how likely people would be to report behaviors back to a researcher just because they thought that's what the researcher wanted to hear, or they're really reporting the true behavior that they undertook. That's one major question. I think that's not one that we're likely to have a very strong view on by the end of the year, and I think it would be a reasonable decision for donors who are on the more skeptical side of things to wait for DMI's final results, which will include measured mortality. On the other hand, if you're less skeptical of how people would respond in those situations, you might find DMI to be more promising. Another issue is with the randomization of the trial itself. They randomized at the radio station level, but the control group ended up being significantly better off on health indicators than the treatment group. So the control group had lower baseline rates of child mortality, lived closer to the capital city, and so you could imagine a scenario where, and this is some of what has been the case, Burkina Faso, which is the country that they undertook this trial in, has seen falling rates of child mortality over time. And so you could imagine a situation where the areas that were worse off started to catch up with the areas that were better off. And so even measured mortality rates from this program might not necessarily be indicative of the program itself, but rather some other factor. A final question that, again, it sort of relates to the self-reported behavior issue that I mentioned before, but is one that we've talked a lot about internally, is the DMI program aims to encourage people to access healthcare when they otherwise might not have. But it doesn't address the availability of healthcare. And so one of the questions that we don't know the answer to, and we don't believe DMI has particularly good information about, is whether if you go to a health clinic in rural Burkina Faso or in rural Democratic Republic of the Congo, where they're hoping to go into next, you would likely find a clinician who can diagnose malaria and provide you with malaria or pneumonia or diarrhea treatment. I think this is a pretty major question. It's one we haven't fully investigated, but is something we hope to have some more information about by the end of the year. Because DMI might end up on our top charity list, a group of staff are also now visiting them on the ground in Burkina Faso in advance of a possible recommendation for DMI. Another organization that might end up on our list at the end of the year is Living Goods. And we haven't written about them at all recently, though. They're an organization we looked at a few years ago, back in 2009. Their model is to provide individuals with health goods, and then these individuals go house to house and sell the goods to families. So they'll be selling things like deworming tablets, bed nets, vitamin A pills. They also ran a randomized controlled trial of their program, and the trial found a 25% reduction in child mortality. That is a very significant results. The estimate of the reduction of mortality from giving out bed nets is about 25%. So this is actually very surprising and much larger than they had hoped for going into the randomized control trial. I think the main questions we have about Living Goods, in addition to some more detailed questions about the trial, are the whether or not we'll have significant information from them longer term as they scale up about whether their program remains effective and whether the results that they're seeing are consistent with the results that the trial found, or whether the only monitoring we're likely to have is going to be the results from this trial. That's something we're still trying to work out. We haven't finished our investigation of them yet, and like the other two, we have a couple people are going to Uganda to visit them next week. But they're also an organization that could end up on the list at the end of the year. The last two organizations I just want to mention both work on the same intervention, and these are organizations that work on a program called salt iodization. Salt iodization is fortifying salt with iodine, and it's a program that has extremely strong evidence of effectiveness. The best research that we've seen shows that for a cost of about 10 cents per person, you can cause a 1/3 or so standard deviation increase in people's IQ when people are moderately deficient in iodine. That's a reasonably substantial result. In areas where people are severely deficient in iodine, salt iodization has an even more substantial impact. It prevents a condition called cretinism, which is a severe cognitive and otherwise developmental disability. And so we were looking for organizations implementing this program because the evidence of effectiveness and the cost effectiveness appears to be so strong. Now, salt iodization is not the type of program that a charity would just go on the ground and implement on its own. Instead, these organizations tend to work with governments to encourage them to implement the program or provide advice and other assistance to help them implement the program well and monitor it. We looked at two organizations that are working on this program. One acronym is in the theme of GiveWell finding recommendations with incredibly unfortunate names. They're ICCIDD/GN. They recently added GN to their name because they didn't have enough letters in their acronym. They wanted it to be impossible for anyone to ever remember what they are. It stands for a lot of things related to reducing iodine deficiency disorder. They're a network of volunteer academics who cover regions around the world, and they talk to governments encouraging them to implement salt iodization, to provide basic advice on how to implement those programs. They are extremely small. Their budget right now is about $500,000 a year. All of the people they employ are volunteer, and ICCID provides a small stipend to enable them to do their work. We have talked to many people at the organization, many people who are working in the field, and we have not been able to document the type of track record of their activities. Being able to say, we can confidently attribute some impact on iodization in a country based on the activities that they've undertook in a way that would be consistent with the standards for a GiveWell recommendation. And so I think right now, when we look at them, they are an organization that runs a great, or is working on a great program, is highly respected and credible in the field, but we haven't been able to document the track record to be able to say, we've seen the impact that they've had historically. The other iodization organization is the Global Alliance for Improved Nutrition. Their acronym is GAIN, and they work much closer to the ground. So they're involved more working, they have more paid staff, they'll sometimes provide equipment, they'll work more directly with implementers, providing the training to government officials to monitor that salt has the right levels of iodine. Similarly with them, we have yet to find the track record that we'd hope for in a potential GiveWell top charity, and we expect that we're not going to have the capacity to finish our investigation of GAIN this year. And so I think that they're not likely to be at the top of our list in 2014, but are one of the likely organizations we'll be looking into more deeply next year. So before I pause and take questions, I just want to wrap this up with two overarching themes that that I think come through in the organizations we've been looking at this year and where GiveWell's work stands right now with our search for top charities. The first is that we're doing far more research on potential top charities this year than we have in any year that I can remember. And I think that's due to our increased staff capacity that we've had over the past couple of years. At the end of 2012, we were 5 people, and now we're 16 people full-time, and much of that additional capacity, some of that additional capacity is going into the other part of GiveWell's work, the Open Philanthropy Project, but a good deal of it is enabling us to undertake an investigation of all of these new organizations. And that's something that has been incredibly exciting about this year and is very different than I think what has come through in our updates in the last 2 years, where we were maybe adding one organization to the list and no more. The other thing that I think is just worth thinking about for people who follow GiveWell is it's always been very important to us that we have a very clear insight into what an organization is doing, so we understand the mechanics of how additional money leads to additional output from that organization. And I think that it's questionable whether one should have the same degree of skepticism or need for that level of transparency into an organization's operations. And so one of the things that I think we'll end up doing this year in some way on our top charities page is we'll have some organizations that meet all of GiveWell's criteria. Organizations like Give Directly, I hope SCI, perhaps DMI, Living Goods, the Do Run the World Initiative, that run outstanding programs and also have been sufficiently transparent with us that we can really follow everything that they're doing. But I think there may also be organizations for donors who have a different attitude towards the benefit of being like that, having that level of insight into an organization's operations. And I think those donors, if you have a different prior about how likely a charity's programs are to work, you should be considering organizations like ICCIDD, GAIN, and then another one that I haven't even mentioned, the Maternal and Neonatal Tetanus Initiative from UNICEF, Nothing But Nets, which is a malaria organization that does bed nets that chose not to apply. And so that's another thing that I expect this values difference that I can imagine coming out between what I think we believe and where we as GiveWell staff are likely to give and where other donors might give is something that will be out there on our top charities page this year and is something worth considering. So I guess I want to just pause there and see if anyone has questions on the GiveWell top charity stuff before moving on to some other topics.
Are there any ethical issues you run into with separating groups into controls and the other groups when you're doing these, randomized control trials?
Yeah, it's a good question. I mean, I think the main way that the trials are set up, and to be clear, we're not the ones running or funding or doing the research, but looking for groups that have done the research in the past. Normally what they do is they find an area where they don't have sufficient money to implement the full program, and then they'll say, well, given that we only have $1 million or something, let's serve $1 million worth of people, but also enroll the same number as a control group, and then randomly select who gets the program. And so that enables them to study the program while also not running into that type of ethical issue.
Do you always rely on charities self-reporting their measurements, or do you ever require them to have a third party conduct follow-up measurements?
Yeah, that's a good question. We tend to rely on charity self-reporting of the information. The approach that we take is to try and drill down into the information as far as we can go. So if we ask a charity, this happened to me, I asked a water charity, what do I get if I give you money? What impact does that have? And they'll say, well, $20 provides child water for life. We wouldn't want to accept that as the appropriate estimate of the impact $20 had. We say, well, can you explain to me what goes into that number? And then can you show me the data that you collected to give you confidence that you should have that estimate? And what we found is that when we push charities on those figures, they either tend to have the data to send us, and we can really see the raw data, in which case they would have to be undertaking outright fraud in order for us to mislead us. Or, and this is by far the more common outcome, they don't have the information to back it up. The situation in the charity world today is so few people or so few donors care about having rigorous documentation of impact that charities tend not to have the information available. And so when you drill down, you very quickly find that the data just isn't there. I think if GiveWell continues to be successful, it's definitely something that is going to be more of a problem for us, because as the incentive to lie goes up, it becomes more valuable. Organizations are far more likely to do so. The final thing is that with a few of the organizations I mentioned, Give Directly, DMI, and Living Goods, these are all organizations where there was a randomized controlled trial of the charities program. I'm sure, was very closely connected to the charity staff because they were conducted at very early stages in the organization's operations. But they were conducted by outside researchers who were not directly operating the program, and the organizations, I know this in Give Directly's case, but I believe it's the case with Living Goods and DMI as well. These were independent researchers undertaking their own academic study, as opposed to charity staff undertaking a study of their own.
So just out of curiosity, have you rated your own organization on its effectiveness?
Yeah, so we do annual evaluations of our performance, and you can read the evaluations on our website. It's all out there. The main ways that we try to think about our performance is first in terms of the quality of our research. Now, this is something that is really hard to measure quantitatively, and so the best that we can do is we try to be as transparent as possible, put everything we do out there so people can review it and criticize us, and reach out to experts if we're going to publish a page on vitamin A supplementation or water quality, ask the people who are more familiar with, who spend their lives researching the field, to comment on that page. So we've done that. Nonetheless, I think it's hard to know at the end of the day how good our research is. Honestly, we don't know, though. I think there's nothing else out there that's doing the type of research that we are. The other measure that we take of our own impact is in terms of reach, how many donors give to our charities as a result of our research. We do our best to figure out where they otherwise would have given. We measure other softer targets like web stats, visits to our website, media mentions. So those are the things we use to evaluate GiveWell as an organization. There is no question, GiveWell itself is not a GiveWell top charity because we're too young to have the type of track record that we would look for. But I think that GiveWell itself remains an outstanding giving opportunity. And I think that's something that sometimes confuses people, but I think is the right way to think about the research we're doing. GiveWell right now recommends 3 charities. That doesn't mean that all charities we don't recommend are bad. It means that unless you have some sort of specific inside information about a charity or about a giving opportunity, you should question how effective it is. And so I think for donors who know nothing about GiveWell and haven't ever looked at our research, it doesn't make a lot of sense to give to us. If you've followed us for a long time, vetted our research, seen and are confident in the impact, then I think we become a decent giving opportunity.
How do you address that challenge of evaluating things where there isn't as much quantifiable data, or whether like the sort of plan is more ambitious and requires like a longer term initiative to achieve it? Like, are you at all concerned about kind of clustering around low-hanging fruit type charities, because that's something you want to encourage, and how do you kind of prevent that, or like bringing qualitative factors as well?
Yeah, it's a great question. I mean, when GiveWell started, Holden and Holden's my co-founder, we wanted to focus on the areas where we, as people who were just donors trying to figure out where to give and who knew absolutely nothing about the charity world, could add value. And so we focused on the most measurable parts of the charity world. That obviously leads out these areas that are high risk, high reward, something like scientific research or trying to influence policy change. Those are things that just don't meet those criteria. And they're things we're looking at as part of this newer initiative that we call the Open Philanthropy Project. It's the name for what we previously called GiveWell Labs. And so that's the part of GiveWell where we're trying to investigate those opportunities. And I'll talk a little bit about that in a couple minutes.
So I was surprised by how many concerns you raised about what you said will likely be GiveWell's top charities recommendations. Is that due to just how rigorous GiveWell is in your analysis, or is it the case that these are the best and the very best have lots of sort of methodological issues and other concerns associated with their research work?
Yeah, that's a really good question. I think the answer to some extent is both. I mean, I think these organizations, I'm trying to speak to this audience as a group of people who are very interested in the nitty-gritty of the charities we look at. And I think when you take that attitude, you want to be picking apart these organizations and finding all the potential problems in their work. If I were talking, I think there's a way of framing, I think not just a way of framing, but the truth about these organizations is they are the very best places that I know where to give. Like, I will happily write a check to one of them at the end of the year. I think it's true. I think part of it is just a presentation issue. That if you're talking to someone who knows nothing about charity, I don't think there's really a comparison between the quality of the work, but also the thoughtfulness of the way these organizations evaluate themselves and the vast majorities of organizations I've come across. That said, I will say that, like, I am surprised 7 years into GiveWell that we haven't found more organizations that are firing on all cylinders of our criteria. I think that Give Directly is one that just seems outstanding on all fronts, though doesn't seem to be as cost effective as some other organizations, and so that is its big potential problem, but is like outstanding on all these other fronts of careful monitoring, transparency, thoughtfulness, doing new research in the field. All the other organizations have pretty significant issues. I think some of them may be outweighed by just taking a straight expected value of the probability they have a problem and the cost effectiveness of what they're doing. But those issues are there nonetheless. And something that we are kind of constantly talking about as a major challenge of GiveWell today is being in a position like 3 years from now where we feel like we have more organizations that are at the Give Directly level of operational excellence and transparency with the intervention level excellence of all the other programs that we look at.
Yep. Do you take into account kind of fixed costs versus variable costs in terms of operating an organization doing these evaluations?
Yeah. So are you asking in terms of like the cost, the impact of marginal dollars donated, or?
Right. Like we look at the charities, you say like $70 for that same impact per additional person served or whatever.
Yeah, I mean, they tend not to have large enough central costs or fixed costs that this makes like a huge difference. The much bigger difference in an estimate of what a dollar given to the organization accomplishes is that the model that you have to construct to say X dollars causes some increase in earnings from deworming, some increase in IQ from salt diatomization, some number of lives saved or malaria deaths prevented through BedNet program. The assumptions are there's so many of them and so sensitive to small adjustments, many of which I don't think we have very good ways of making good judgments about, that those overwhelm these other changes. And so when we think about cost effectiveness estimates, we tend to think in terms of factors of 4 or 5x, as opposed to changes that might even be 10 to 20% of the program's cost effectiveness. And that's like somewhat, I think that is somewhat counterintuitive, but when you dive into the details of what you actually have to do to come up with those estimates, it makes more sense. And this is something we've written some about on the website if you want more detail. All right, last question, and then I'll move on to the other.
Do you know why Nothing But Nets decided not to work with you?
Yeah, so we wrote a blog post about this earlier in the year. We're not totally sure. What they told us is that they're limited staff, and they didn't have the time to go through our evaluation process. What we know about Nothing But Nets is they have a staff of about 5 people. I think over the course of their existence, they've moved a little bit more than $30 million. And a GiveWell recommendation to Nothing But Nets would probably be worth on the order of $5 to $10 million. And so it didn't fully make sense to us that that was the primary reason. It's also the case that, we told them we've already done all of this research on malaria net programs. And so what we're looking for from you is evidence that you can get money into the field, that you monitor your distributions, you have evidence that the distributions are going well, and if you can provide us with that, we will, you would almost certainly get a recommendation. So I don't know why they ended up not participating. I think it's possible that just when you're so capacity constrained and something like GiveWell comes to you and it requires a different type of communication and is going to be more intensive, it could lead people to not want to engage. But I think the question and the general feeling that it is a strange and weird outcome that they didn't participate is true. All right, I guess I want to just move on to talk a little bit about some of what we're doing in the future, which is different than exactly what we've done in the past, and then can take more questions both on that and then also on the anything I said earlier on the GiveWell Top Charity side. So there's 2 parts to this. One part is focused on more experimental work to find new top charities for GiveWell, and then the other is the Open Philanthropy Project that I mentioned before. So on the finding new top charities for GiveWell, you asked this question, why don't we have, are we disappointed in the organizations we have? What's wrong with this? This is something that we find really challenging, and we'd like to see better organizations in the future. And so we're doing a couple of things. One is when we're looking for organizations implementing programs that have strong evidence of effectiveness and are cost effective. We call these priority programs. And so when we see an organization or if we found an organization implementing a priority program that needed money to get off the ground, we would give them funding. And so Good Ventures, which is a foundation we work very closely with, gave $100,000 to an organization called New Incentives at the beginning of the year. New Incentives implements a conditional cash transfer program where they give cash to pregnant HIV-positive women who come to receive the AIDS drugs that prevent mother-to-child transmission of HIV. This organization is very new. They don't yet have a track record, but our hope is that by giving them some funding now, we're able to come to the outcome a few years from now where we have another top charity. The other type of work we're doing is trying to strengthen the evidence base for some of the programs that we are looking at. One of the things that, the entities we recommend, the organizations that are top charities, tend to have evidence for their activities that come from multiple randomized controlled trials. And there are also academics who are conducting randomized controlled trials of new programs. These are often happening at the Poverty Action Lab at MIT or Innovations for Poverty Action. But sometimes there's only one trial that exists. And so we are interested in supporting additional research to make the evidence base for these programs more robust. Because if the evidence base were more robust, we would be more interested in supporting additional donations to these programs. Finally, we've talked to both of those organizations about potentially funding replications of previous trials. Finally, there are times where there are trials that have been conducted, but no organizations are implementing the program. And so we provided one grant to Evidence Action, which is the parent of Deworm the World, which is one of our recommendations, and another to a group called IB Insight to try and identify partners to scale up programs that previously had strong research results, with the hopes that eventually these organizations will become top charities. So that's one of the more experimental, newer part of GiveWell's work, trying to support the creation of new top charities. The other part of that's newer is what we call the Open Philanthropy Project. And the idea here is that when GiveWell started, we were very tied. We wanted to focus on the areas that were objective, more quantifiable, because we knew so little. But there are these areas like scientific research or policy-oriented philanthropy that could be the highest bang for your buck, but are not ones that met our traditional criteria. And so the Open Philanthropy Project is aiming to broaden the scope of the research we do to find opportunities that in these areas. Now, this is much more challenging than, or it's challenging in a different way than the traditional work that we've done. With our traditional work, we could just say, well, we're looking internationally at a set of priority programs. Let's look at all the organizations that potentially implement these programs and see whether they're a fit for our recommendation. And because the set of programs is small enough, one can actually go and look at the 100 or so organizations that are implementing these programs and eventually reach out to all of them. With something like scientific research or policy-oriented philanthropy, the set of organizations we can support is much wider, is much larger, and the criteria that we would use to judge whether an organization is a good fit or not is much harder to determine. And so the path that we're taking now is one where we expect to have to become reasonably familiar with a field that we're looking into. And so if we're looking into US policy, and we're going to the area that we have funded most so far is the area of criminal justice reform. And if anyone's interested, I'm happy to get more into the details of our process and how we arrived there. But in order to make good judgments about what's worth funding and what's not, we think we basically need to have a full-time staff person committed to that area for some period of time. And what that means is that a very major decision that we need to make for the Open Philanthropy Project is about which areas we'll eventually prioritize as being worthy of putting a full-time staff person on them. And so most of what we focused on this year in Open Philanthropy Project is choosing the areas that will be our focus for the next couple of years in policy-oriented philanthropy and the area we call global catastrophic risks. So those are things like a very rare event. I think the probably most well-known example is an asteroid could hit Earth and wipe out humanity. It's very unlikely, but if it were to happen, it would be pretty catastrophic. So we're trying to, those are areas that, the private market is not well suited to prevent. Governments maybe, but it's not clear that they've always covered all of the areas that need funding. And so we're trying to identify the areas in which we'll focus. In both of those, I think the leading contenders for the areas that we'll pick in US policy are criminal justice reform and labor mobility, making it easier for people to migrate from the poor world to the richer world. And then in global catastrophic risks, they're most likely to be biosecurity and geoengineering, which is a part of climate change. The other sort of general categories of open philanthropy that we hope to make stronger commitments to next year are foreign, global health and development, and scientific research. these are areas due to capacity we just haven't made as much progress on so far this year. Our vision for open philanthropy and GiveWell overall, I think that we've gone through a process of pretty significant growth over the past couple of years. We've gone from being a staff of 5 to being a staff of 16, and our money moved has gone from being a few $1 million just a few years ago to being more than $17 million last year. And when I look at our donor base and how it skews very young, and the creation of wealth that is happening now certainly in Silicon Valley, and the level of access to information that is currently available both to the small donors like the one I was back when GiveWell started, but also the large billionaire philanthropists. I think the trend is strongly in the direction of significantly more interest in this type of work. And so, I mean, I think that what you should expect from GiveWell and the Open Philanthropy Project 5 years from now is, an open philanthropy project that looks much more like a very transparent foundation that's making grants and reporting on things, on how things are going, and a GiveWell that continues to maintain the same level of rigor in its analysis and continually improving recommendations. So let me pause there and see if anyone has any other questions.
What percentage of the charities you work with are open to sharing their data with you, and what percent are less transparent? There are concerns that charities like Give Directly that seek to have a very good relationship with GiveWell are receive favoritism, and especially if they know GiveWell very well and they know the criteria that they're evaluated on, so they could provide information that is relevant to those criteria.
Yeah, it's a good question. I mean, I think earlier on in our history, this was more of a challenge because we were reaching out very widely to many organizations, and the incentive that they had to participate was much more limited. I mean, I remember talking to charities in 2009, trying to encourage them to apply, and they were like, what do we get again if we talk to you? I'm like, maybe some money. And so as that has changed, so that's something that back then, I think it was more likely that our recommendations were skewed towards organizations that were interested in talking to us. Even then, it remained the case that the organizations that talked to us then often already made really substantial information about their activities publicly available, and the offer of money didn't make a terribly big difference to those organizations' decisions to apply. I think it has improved things though now, because now we sit here and we have this large pool of money we can potentially direct to organizations who participate, and we carefully select the organizations we want to talk to. So anyone is still we're totally open, and we review every submission that comes in, but most of the organizations that we end up working with are ones that we reach out to and say, we think you meet our criteria because you implement a proven program. Let's discuss how you could give us this information that would lead you to be recommended. And we're very explicit with them about the process, but also the potential for receiving significant funds at the end of the whole application process. And so I think at this point, I guess I'd be surprised if there were many organizations that somehow more inside knowledge was enabling them to answer our questions better. I think more of what I think a problem we still have yet to fully overcome is maybe what you could call the nothing but nets problem. Why is an organization that seems like it should be a very strong contender not applying? Is it really because they don't have the information, or is there just a limited communication between us and them in a way that enables them to think they're really as good a contender as they are?
Has GiveWell thought at all about identifying areas for promising nonprofits or having some sort of incubator for nonprofits?
I mean, we have our priority programs. So these are programs that have great evidence behind them and are not yet reaching everyone in the world. And we would love to see people like trying to run those programs. And if we saw them, we'd be excited to support them. I think the ability, so we could potentially provide funding. I think to actually like incubate them is a step and provide like a great deal of oversight and advice would neither be particularly helpful because I'm not sure that, I mean, I don't think I have the knowledge to really help someone figure out how to implement a program on the ground in Nigeria. I think like they need to be there figuring it out and then letting us know how it's going, and we can ask questions, but we can't really like drive it forward. But yeah, I mean, when people ask us like, what is something that people could do that can have a big positive impact on the world, organizations that are people who are figuring out how to start nonprofits that bring these priority programs to people in the poorest parts of the world is one like really outstanding opportunity.
So when I make a decision on how much to donate, what I care about is something like the prospect of marginal utility in the world for my donation. You guys use several goals which I read as things that were there in the first place as proxies for something like what I care about. So things like the room for more funding and of course cost effectiveness and the level of evidence. It's all, the prospect is the evidence and the room for more funding is the marginal. But they're not perfect proxies for it, and it's not like, when I hear you, when I read the blog post, it sounds like if you rank kind of well on several, that kind of, it's as though they're independent from each other. So if you have an organization with wonderful evidence of positive middle of the road effect, maybe that's what you give directly, you guys go gaga, but maybe I wouldn't, because what I want is, high prospect, which is not just a function of evidence, it's a function of effect as well. Or if there is an organization without too much room for funding, but I don't expect that other people will give the funding, so the marginal utility remains high. You guys are skeptical, and I'm happy, or cost effectiveness, you measure last year's cost effectiveness, and you say, if last year there was, say, a bottleneck for DMI, you can send people to the clinic, but in the clinic there aren't services available. Suppose it's the case that I have some reason to expect that next year the clinic will be, offering services to people who actually come there. I don't mind that they were not cost effective last year, right? I just care about the prospect in next year for me to make a big difference, and I just wonder why there isn't kind of more attention to that fundamental goal, if I'm right that this is the fundamental goal.
So the maximizing future utility is conceptually the goal we have too. And I think that the thing that we're not willing to do is try to turn all the criteria we use into one formula. So, I mean, we don't care about DMI's cost effectiveness last year, except insofar as it's indicative of what their cost effectiveness is in the future. We don't care about the great information we get from Give Directly and the, confusing or somewhat less clear information we get from SCI, except insofar as it means something for the effectiveness of their program. So, I mean, that's 100%. Anyhow, I fully agree on that, and I think we're probably aligned on that front. And then the question is, how do you weigh these different factors, and what impact should they have on your ultimate decision about where to give? So with SCI, I think just to make this example really concrete, at the end of last year, our best estimate of the difference in the cost effectiveness between cash transfers and deworming was a factor of 3x, meaning, and again, there's all the caveats that go into the model of cost effectiveness, and I'd be happy to talk about that at length. It's one of my favorite topics. But, our best guess was that if you gave to the generic deworming organization, it was 3 times as cost effective as the generic cash transfer organization in terms of the impact of future dollars. And then we say, well, we have this overlay both organizations were pretty similar on future room for more funding considerations. And then we have this overlay that with SCI, we had some challenges getting answers to our questions. That was kind of a vague concern. It's something you can read in blog posts we wrote over time. I wrote a blog post about why I didn't give to SEI a couple of years ago. You can read our updates on SEI. We just struggled to get some information from them about what they were doing. The model we had in mind for SEI was something like a black box, which meant we saw that we sent them money and we saw that people got dewormed. And that wasn't perfect, but that was still pretty good. The problem that situation creates is one where if something goes wrong, I think we're less likely to know about it. And then last year, at least, not necessarily something with the program, but something with our understanding of the monitoring information went wrong. And what changed is that we went from a belief that there was significant evidence that SEI's programs had demonstrably resulted in deworming kids being dewormed to a situation where we no longer felt like we had that evidence. If you believed, you can, I think it is a defensible position that SEI is all these things are true. SEI is an outstanding organization in the scheme of things. Deworming is an outstanding program. SEI is highly credible and respected in the field of deworming. Like, none of these are debated. But it's also the case that we had written for years about monitoring studies that, and SEI had reviewed them, that showed things that they didn't actually show. They weren't this type of monitoring result. If you believe that deworming is really simple and there's no problem with it, I think and money that goes to SEI will result in deworming, and you're like not worried at all about the problems that could happen, I think you probably should decide to give to SEI. On the other hand, I think if you have more skepticism about the way that global health and development programs can be implemented, that you might want to ask whether lack of evidence of track record and problematic communication could be indicative of other problems occurring in the future. I think this problem becomes even more difficult now. In some ways, you could say it becomes easier. Like, I think deworming is likely now more cost effective than it was in the past. It's always been the same, but now we have more information to shore up the evidence base, and that should affect your view of how cost effective the program is. I think this is I think it's a really tough judgment call, and one where I think people are going to have to make their own decisions, and there's no clear answer about what's right or not. One other thing I think is worth thinking about is there's the marginal utility your donation affords to the people served by the charity, and then there's also this other, and this is another thing that I think you could definitely question, but it's important to me, is the utility of a GiveWell-like entity learning about aid programs. And because of our ability to follow up with a group like SEI, we were able to learn about these problems with the study. We were able to think more carefully about what type of research should be done next. The next stage of the path along, I just want to give my money to the organization that I would bet will spend it best, is giving to an organization that doesn't participate in GiveWell's process at all and affords us and the world virtually no learning opportunity. And I think that is something that, I think that a big part of the value we offer is, and we offer not only to donors, but really to the world, is that follow-up and learning. But if you're a donor who says, I don't care about that learning at all, I just want to maximize the value of my donation in the next 12 months, I think then organizations like Nothing But Nets or the iodization ones I talked about are at least worth seriously considering.
Do you evaluate organizations that are attempting to validate some sort of proof of concept around a specific poverty alleviation tool that hasn't yet come up with quantitative metrics for their success, but if they were to validate some sort of proof of concept, it would be incredibly scalable, globally?
It would depend on the specifics. It's the type of thing that has traditionally been outside the scope of what we would do. an organization was trying to validate a proof of concept around a program that had significant evidence. So let's say someone was saying, right now, about 80% of the world's children are reached with routine immunization services that we all receive when we're very young. And we have this, what people often refer to as like the last mile problem of reaching those 20% who haven't already been reached. This does not appear to be a problem of simply adding money to the pool that goes to fund vaccines. It's like a more challenging logistical problem of reaching these final 20%. If an organization had an approach to trying to do that, I think we would be like pretty interested in it because they're trying to bring this program that already has significant evidence behind it to a new group of people. This is what an organization we recommended years ago, Village Reach, was trying to do, bring immunizations to the last mile. Certainly an organization like New Incentives that I mentioned fits right in the category of the type of new organization that we're interested in supporting. On the other hand, an organization that says, I have a new approach, we have a new approach to development, we're going to spread we're going to give everyone like solar panels or something. If they don't have a very concrete plan for monitoring that in a way that we will be convinced that their program, if effective, really caused the impacts that it hoped to, then it's something that we wouldn't be as excited about.
Can you talk about how you decided in the Open Philanthropy Project which global catastrophic risks were the most dangerous or the most tractable, how you prioritize those two, and which other ones you prioritize them over?
Yeah, so I'm not the one who did this work, and I can't give you a satisfactory answer to that question. Procedurally what we did is we made a list of all the global catastrophic risks that we could think of. We came up with a list of like 10 or something. We did what we call shallow investigations of all of them. That consists of talking to experts who are very familiar with the field about things like asteroid risk or nuclear proliferation, super volcanoes. I mean, they're kind of like fun topics, that sort of type of thing. And then try to, and with that in mind, use that as the data set that we use to prioritize. Before we make our final decisions, we're planning to host some sort of convening with outside experts where we say, like, here's our list of priorities for global catastrophic risks. Do you think we've prioritized these appropriately? Are there ones that we've missed? Are there mistakes that we've made in our research? To hopefully make the process as robust as possible. Interestingly, a couple months ago, we were about to publish a blog post where we were going to announce our priority areas. And before we publish our blog posts, they go internally and people review them. And when people reviewed them, they started asking a couple questions that were like, well, what about this? It doesn't seem like we sufficiently looked into this area of geomagnetic storms, which are solar storms, basically like sun flares that could potentially destroy the electrical grid. And so that caused us to do a revisit internally of whether we had appropriately prioritized them. So there should be more information about that. I'm just not the man to give you the answer. Yep.
I'm wondering if you think about how to broaden the reach and the impact of your research and recommendations to a wider group of donors and charity donations. It seems to me, you mentioned this earlier, that it's only a small fraction of actual total charitable donations made that are based on really any rational choice process, let alone something as rigorous as GiveWell's research.
Yeah.
And so it seems like you can kind of push the needle a little bit if you're optimizing the impact of a given chunk of donations, but there's a lot of untapped potential if you could expand that base. So I wonder if you see that as something that's just outside the scope of your organization, or if you are thinking about that.
Yeah, that's called we call that the research versus outreach debate. It's the most long-standing debate in GiveWell history. Largely, it was an argument Holden and I had with our board. I'm just laughing because Tom is here. He's on our board of directors. Sorry for playing. But we had this debate with our board of directors for years about should we be prioritizing research over outreach. The way that we're thinking about this now is we have consistently prioritized doing research over trying to do outreach. we've done that for a couple reasons. One is that the most effective outreach strategy we've ever had has just been doing really great research. The best example of this is the philosopher Peter Singer, who talks about giving effectively. He has written a book. He's a major advocate encouraging people to give, people in the rich world to give more money to people who live in the poor world. He has been better than any marketing department we ever could have hired or trained internally. And the reason he is out there talking about us is that he has vetted our research, he's followed us for a long time, and he's confident that we're doing high quality research and he can point to us. And with the type of work that we do, I think losing that credibility that we do the best research that's out there would be incredibly harmful to the work that we do. Second, we're just not satisfied with the research that we've done. I think there's like a ton left to do on finding more great charities, both for our traditional international aid charities work, but also with the Open Philanthropy Project. And when I look at the overall trends, what I see is I think the money that will come to the charities we recommend will be there, because the societal trend of younger people being interested in what we do and people of our generation just feeling entitled to get good answers to the questions that they have in a way that, like, I think many people who I've talked to about charity over the years are not as interested. They have the organizations they support and they don't want to engage in that type of, they might not even believe that they could go online and get good information about where to give. But I think that's changing. And I think we want to be positioned I think now we have the best research that's available to serve this group of people, but it's not at the level that I hope it should be, or that it should be to serve them, and I hope it will be there in a few years. Finally, our growth in reach has been pretty good. We've roughly doubled in the money we've directed to top charities every year we've been in existence. I think that's starting to slow this year, so I doubt we'll hit that number for 2014. But sort of objective metrics of growth have been good, if not tech startup growth levels. Yeah. And so those three things together have led us to put all of our priority into research as opposed to outreach. If I had to guess, I would guess within a few years we would have more staff dedicated to doing that type of outreach work, whether it's more like one-on-one meetings with donors or trying to write more interesting pieces for the blog or a book or something that gets the word out there. Yeah, we just haven't had the capacity to focus on it.
How did you decide to focus on U.S. policy rather than international policy within the Open Philanthropy Project? So you mean how do we think about policy change at the U.S. level as opposed to other countries? Yes. Yeah, we basically, I think there's two reasons. One is the U.S. is the largest country right now. And so I think the influence on our government would have more impact in the short term than on other governments. It's also the place where we just have the most context and we're best positioned to learn about how to do policy-oriented philanthropy well. We just have contacts in the US system that would not be available to us in Europe or India or China or something. And so as a starting point, it made a lot of sense for us. That said, we've had a couple of conversations, and I think one of the things we do when we talk to outside experts, we write up summaries of those conversations, we put them on our website. We've had a couple of conversations with groups that do policy, are think tanks working in India and China. And that's just something we've just started doing, but you easily could believe that 30 years from now, the countries where you'd most like to be able to have some ability to engage in a dialogue around policy are India and China. And so I think long term, we hope to be there, and there's no reason that we think US is the best choice relative to some other location. And that decision describes a lot of how we think about our work at GiveWell. Sometimes, when our work is more evolved, we're focusing just on the best choice possible. And I think that's where our GiveWell top charities work stands right now.
with the Open Philanthropy Project, it's so new that some of what we're prioritizing is the research that we can do internally that has the highest return on time invested, or the best learning that we can get from the work that we put in, and that's where I think US policy is for us.
Okay, I think we're going to cap it at that, and a lot of us will hang around and talk if you have more questions. So let's give another thanks to Elie.